Okay, so we will be starting our second mark scenario, and our candidate is ready with us. So, doctor, as soon as I show you the next screen, your 90-second timer will begin. Okay,
All right.
so, okay.
Hello, is it Mrs. Dinah Smith I'm talking to?
Yes, that's right.
Hello,
Yeah, doc.
sorry. Should I continue?
Yeah, doctor.
All right.
Yeah.
So I am Dr. Ishwari, a junior doctor in this hospital, and I am here to, talk to you about your discharge. So can you please confirm your age for me?
Yeah, doctor. I'm 35.
All right. Okay. So, Mrs. Dinah, is it okay if I call you that?
You can call me Dinah.
All right. Okay. So, Dinah, can you please tell me in brief what got you to the hospital in the first place?
Doctor, actually, I was having the swelling of my right leg, and there was
Mhm.
also pain. So I came to the hospital, and then they told me there is some clot in my leg, and that's why I'm having these symptoms. But they told me that now I'm good to go to home. And before that, you are supposed to talk to me about something.
Yes, yes. So it's good to know that you're ready to go home, and I hope everything is fine with you at the moment.
Yeah, I'm fine. The pain is better.
That's good. That's good. All right. So as you were informed that I'm here to talk to you about the medicine that we have given you. So do you have any idea about what it is?
No.
All right. So okay, we will come to that a bit later. So can you please tell me, is this the first time you have had this problem, Diana?
Yes.
Is it the first time that you've had this problem?
Yes, doctor.
Okay. And by any chance you have
Can you hear
any?
me?
Yes, I can hear you, doctor. I think there's a lag somewhere.
Okay.
Can you hear me?
Yeah, just continue.
All right. So can you please tell me, have you ever been diagnosed with any medical condition in the past?
No.
And are you taking any regular medications?
No.
All right. Okay. So is there anyone in your family that has the similar condition?
No.
All right. Okay. So about the medicine that you are prescribed, it is warfarin. All right. So it is a blood thinner. Uh, it will prevent any further
Okay.
clots to be caused in your blood, which brought you to the hospital in this scenario. Are you with me?
Yeah, doctor, I'm listening.
All right. So this is the medication that you have to be that you have to take it very regularly, and you do not have to forget it even a single day. Okay.
Okay. Okay, doctor. For how long I need to take this medication?
Well, it's really uncertain to to tell it right now, but like from what I know, you have to take it every day for a certain amount of time, and we will be looking at some blood parameters on a regular basis so
Mm-hmm.
that we know how to adjust the dose, if you have to continue it, if for some time you have to discontinue it. But all of this will take place only after some consultation with a senior. Are you with me?
Yeah, doctor. Doctor, I'm a bit concerned. Are there any side effects of this drug?
Well, it is a very valid concern, I can say. So there are some minor side effects that you might feel, some nausea, some vomiting, you might have that, or you might not have that. But if you have any such thing, you should always come to the hospital or go to your GP and consult, and only then take some medications for the symptoms that you might be having. But it's nothing to worry about, Dinah.
Mm-hmm.
All right, but I have to warn you, or I have to, inform you that there might be some serious side effects too, and the most dreaded one is bleeding. So, as you know, this is a blood thinner. So, if you ever happen to notice any bruises on your body or bleeding from anywhere in your body, like maybe bleeding from nose or bleeding from bleeding in your poop, so you have to immediately come to the hospital. Are you with me?
Yeah, doctor. But if it is a major side effect of this medication, then why it is so important to take this medication?
Well, see, as I told you, the side effects, this can be managed. Okay, this can be managed very easily if treated in time. Do you get it?
Mm-hmm.
And
Yeah.
the benefit that this drug or this medicine is going to do to you is really much more than the fear of the side effect. Okay.
Okay, doctor.
And also with the side effect, with the fear of side effect, we will be always monitoring your blood parameters that I just told you. It's called as INR. All right, so it is a test that we do to check that is the medicine dose that we're giving you, is it the proper that you need, or is it more than expected, or is it less than what you need, so we can at least hope to prevent any major side effect. Am I
Okay,
making
okay,
sense?
doctor. Yeah, doctor. But just as you told me that the bleeding can occur, so by any chance, if I get myself injured or I get a cut, what will I do for that?
Well, if it's a very small kind of an injury or a small cut, you don't have to worry much about it. Okay, whatever we generally do, apply a bit of pressure or run some cold water over it. You can do that, but of course, if it is a major injury, if it's bleeding for too long, you have to come to the hospital immediately. Am I clear?
Yeah, doctor. Thank you.
All right, so I would like to mention a few more things here. So I will be giving you a small diary. All right, so you have to note down your INR levels that we will be doing in the hospital, and we will be informing you about the results. So you have to mention it, the day on which the test was done and the result of it in the diary very meticulously. Do you get me?
Okay. Okay,
All right.
doctor. I will do that.
Uh, and along with that, you have to also mention the amount or the dose that we are giving you of the warfarin tablet, so that we can have a proper record as to how we are increasing or decreasing, and we can have a good look at it whenever we need. Okay?
Okay, doctor.
All right. So also I will be giving you some leaflets, some booklets to read about some details about the medication. You can read about the the condition that you're going through. So some details will be there in the booklet. So you should, I think you should go through it. Okay.
Okay, I will give a read.
Yes. So there is one more thing that I need to mention is so there are some things that you would avoid, all right, when you are on this medication. All right. So the first thing is any drugs that some drugs like aspirin, some drug like ibuprofen. So these might um, precipitate bleeding. Are you with me?
Okay, doctor. Okay, go on.
Okay, and if you ever have, I know in future, if you ever want to visit to the dentist or to have some very minor procedure done on you, you will have to carry this record book. There's one more card that I'll be giving you, the alert card. So you have to carry all this with you so that the doctor who will be doing any procedure on you knows that you are on this medication.
Oh,
Okay.
I understand. I understand.
Yes, yes. And also, by any chance, if you are on this drug, you have to avoid pregnancy because this drug can be dangerous to the baby.
Okay, okay, that's really important. You have told me.
Yes, yes. I hope you will remember this. Okay.
Yeah, yeah, doctor. I will try to.
Okay. And also, I would like to mention about alcohol. Do you have alcohol on a daily basis?
No, just occasionally on the parties.
Well, that's good. And if you ever are going to be taking alcoholic drinks, I would say not more than one or two per day because, again, alcohol can interfere with the medicine that we're giving you. Okay.
Okay, okay, doctor.
All right. So, do you have anything else? Maybe you wanted to ask me any concern?
Mm, no, no, doctor. Is there, like, you can tell me one thing, like, is there
Yes.
anything important I should avoid in the diet?
Well, yes, it's a good question, I will say. In the diet, you can have a regular balanced diet that you usually follow, okay? But of course, if you are planning on changing your diet ever, like going completely on the vegetables, like especially the dark green vegetables, they might have something called as vitamin K more in them, and that will interfere or that will precipitate bleeding. So if you are ever planning on having more of these vegetables, please inform the hospital before that.
Okay, thank you very much, doctor. Thank you.
Okay, so is there anything else that you would like to know?
No, doctor. Thank you very
Okay, I hope I have made all your doubts clear. And if there is ever anything else that you need to know, you can anytime come to the hospital or just give us a call. All right.
much. Okay, thank you.
Thank you. Nice meeting you.
Nice to see you, doctor.
Okay, so thank you so much, Dr. Ishwi, for performing with us. You've really done a great job. And
Thank you.
I will be starting going into few details. Most of it you covered
Yes.
pretty well, but just a few details I would like to begin with.
Yes. Yes. Sure.
So, okay, your introduction was good. You told the patient the purpose of your visit, which is also good. You identified the patient and you asked the patient how the patient was doing. When you started the session, you asked how she was doing. She told you that I'm doing fine, I do not have any pain now. Well, that is something reassuring that the patient told you, but it is also better to still for the video because data gathering still has 4 marks, although this is a counseling station, right? So for that purpose, you can, and for the purpose of IPS, you can still ask some questions like, do you have any redness, any swelling? Are you able to walk around? Because this is very important before you discharge the patient to make sure that the patient is safe to go home. Then you can ask the patient if she's satisfied with the care provided. Again, this is just for the purpose of IPS.
Yes. Yes.
Other than that, you asked her about the understanding of the medication, which is very good. You should
Mhm.
the person already told you about the understanding of the problem. Otherwise, you could have also assessed that if he has any or she has any understanding of the condition she has. But she already told you that I know there is something like clots. If you feel that the patient is not very clear, or she doesn't know, from her tone it feels like she knows that this is clot but she doesn't know what it is all about, you can still go into a little more detail, or you can just repeat that sometimes the clot happens in your leg and that causes the pain. Suggest that the patient understands what the diagnosis is.
Yes, all right.
Now also it is important sometimes to use the medical term. By that I mean you can say, yes, you're right. When she told you about the clot, you could have said, yes, that's right. You have something called deep vein thrombosis, which is also known as DVT, and that is, as you rightly mentioned, it means there is clot in the leg. So because sometimes the patient should know their
Mm-hmm.
medical condition as well.
Yes, okay.
Then you did ask about the medication. Any idea? They said no. That's fine. You asked about the past medical history. This happened before, but sometimes we need to try to figure out the risk factors. Why did this happen? So that you can address later on in the counseling. So, for example, you could have asked if she's using any contraception because she's a young lady. You could have asked if
Yes.
she has had any recent flights, long flights, or her
Mm-hmm.
work, nature of work. Maybe she's sitting for 12 or 16 hours at work,
Mm-hmm.
right?
Yes,
So
right.
these could be the risk factors. So we can address those. You gave a very, the general advices. You covered almost everything. But if we know what her risk factor is, we can also talk about that. That will give us
Okay.
more marks.
Right.
Right. Yeah. You did come on the alcohol part in the end, but again, it is advisable to ask about the alcohol and smoking there itself because that will count with your data gathering. And later on, you'll not just be talking in air because you know that the patient is the patient drinking or smoking or not drinking. So it will help you in the
Okay.
management. Otherwise, it will take some of your time.
Okay.
Again, it is also advisable to ask who she lives with because if the patient is alone, we might need someone to be with her because she's just started warfarin,
Mm-hmm. Yes.
right? Again, this is
Yes.
just to be a safe doctor.
Mm-hmm. Right. I understand.
Yeah. And you understood actually that this is a counseling session, so you kept the history short and you pretty much soon went on to the counseling, or you understood your task. This is something good. I wouldn't say you should go into a lot of details of all of this because that will take your time. This is not a history based station. So just
Mm-hmm.
one or two questions in each part and you should be good. All right.
Okay.
Then yeah, you started by telling her about warfarin and that this is a blood thinner. You should be taking it regularly, which is fine. The also good part is that you address patients' concerns. So you address that patient asked you how long should you be taking it. If you are not sure, in case you can always tell the patient, I'm sorry, I am not sure. How about if I go ask my senior and come back with an answer? So that's
All right.
totally fine. As an FY2, you do not have to have all the answers. And
Okay.
but in this kind of scenario, you can say that 3 to 6 months.
Okay. Fine.
Okay, at least 3 to 6 months. All right. Then yeah, you mentioned about the side effects. I thought that you might forget about the bleeding, but no, you later brought it up, which is very important. So you covered the side effects pretty well. You addressed the concerns. One more thing is that when you tell the patient you have to take it regularly, and it has to be taken for 3 to 6 months, it is very important to tell the patient that for the first few days or the first few weeks, we will be calling him up to check his blood levels or the INR initially on
Right.
daily basis, then every other day, and then after that it will be done weekly or every 2 weeks.
Mm-hmm. Yes. Okay.
Okay? Now, one or more important thing is that we kept mentioning INR, but we never clarified what INR was.
Right.
So we should tell the patient INR is the tendency of your blood to form clots or how
Mm-hmm.
thick your blood is.
Okay.
So that the patient understands why do I have to have this test again or why so continuously. And then tell him that according to your INR or according to this blood test, we will be changing your medications accordingly or we will be adjusting your dose accordingly. Well, the
Okay.
patient asked you about what happens if I cut myself. He has rightly said if he cuts, you have to apply pressure for 4 to 5 minutes. If the bleeding is doesn't stop for the next 10 minutes, then immediately come back to us. Your answer was correct.
Okay.
And Okay, so the time was up after this, but you did continue telling him about the booklet or the leaflet, the record book, and the alert card. Uh, if we would have time, definitely would have gone into the details. You mentioned that leaflet, he can go and read about it. For the
Mhm,
booklet, yes, you mentioned he has to keep a record of the dose of the iron of the warfarin and the INR levels each time he comes. And
mhm.
the alert card is something like a small credit card which has the information of the patient, what medication he's on, and what diagnosis he has, so that if he goes to any dentist or anyone else at all for any kinds of procedures, they should know that he is on this medication. Rightly said. Then you went to the general advices. Your general advices were pretty good. Just to add a few more, yes, she has to avoid the pregnancy, but that means that does not mean that she cannot be pregnant. If she's planning on getting pregnant, she has to come at least 1 to 2 months before, so that we can change her to some other medication like low molecular weight heparin.
Okay, yes, definitely.
Yes. Um, yes, you mentioned about binge drinking or alcohol drinking. It is one of the risk factors. You can tell her that she shouldn't be sitting cross-legged for a long period of time, as that can also
Mm,
cause stasis of blood. She has to walk around, even if she's at work. If she had given you the positive history of sitting at work for 12 hours or 16 hours, we could have talked that she has to take breaks. She has to walk every half an hour, every 1 hour to
mm.
avoid this. Okay.
Okay.
When you mentioned about the diet, yes, you mentioned about the green leafy vegetables or the green vegetables that can cause this. Another important thing
Mm.
to avoid in diet is cranberry juice.
Oh, yes.
Okay.
Yes, I forgot that. Yes.
Yes, that's totally fine. You cannot cover each and everything in these 8 minutes. But these are just things in
Mhm,
case for the next time you might remember. Again, in 8 minutes, covering all of this is not easy, and
mm.
warfarin station is actually a long station. So the time management is not a problem as long as you um, addressed all the concerns of the patient, and you did that.
Mhm.
Okay. So do you have any questions for me?
Um, no, actually, you told me a lot, so it's really good. Thank you so
Okay.
much.
Thank you so much. And Dr. Adnan, would you like to add something to this?
Uh, okay, thank you, Dr. Aruj, for giving such explanatory feedback. And, you almost covered all the things. Just one thing I would like to add is that when you are sending the patient home, you have to tell about the complications as well. Also tell the patient, do the safety netting, that by any chance, if you develop any chest pain or shortness of breath, you have to come to the hospital right away, because one of the complications of the DVT can be a pulmonary embolism. Okay,
Yes. Mm.
so the main core of the station is to explain about the warfarin, but you don't have to forget about the DVT. So it's always better if you also do the safety netting about her medical condition as well. The rest of the
Okay.
things they are already explained.
All right.
Okay.
Okay.
Any other question you would like to ask?
Thank you so much. It was really good. Like I feel fortunate to get this chance.
Thank you so much. It's we'll be conducting such sessions again, and it's really takes courage to be speaking up or doing a mock in front of other people. And I should really appreciate both of you for doing that, for showing confidence, and for coming forward. This will really help you in the exam.
Thank you
Thank
so
you
much,
so
Dr.
much.
Aruz. Thanks a lot.
Okay. Thank you very much, Dr. Aruz and the participants. Goodbye.
Thank you so much all again for participating, and thank you, Dr. Nan. Have a great day. Bye bye.